Here, in the intricate ecosystem of the human mouth, a battle is constantly being waged. It is a slow, often silent conflict. This process is known as dental caries, or what many call a cavity. It affects the hardest substances in the human body, the teeth. Caries is not a simple stain or temporary blemish. It is a progressive disease, a gradual deconstruction of the tooth's defenses. Almost everyone will encounter this adversary at some point. It is a story of biology, chemistry, and behavior. Decay does not discriminate. It can begin on any tooth surface at any age. Yet it prefers certain territories. The chewing surfaces of our back teeth, the molars, are prime locations. To truly understand the nature of caries, we must first look at the structure it attacks. A tooth is a marvel of biological engineering. Its outer layer, the enamel, is the hardest substance in the human body, harder even than bone. It is composed almost entirely of minerals, primarily hydroxyapatite. This dense shield withstands immense pressures of chewing and grinding, protecting the sensitive layers within. But it has a critical weakness. It is highly vulnerable to acid. This is the chink in its armor that bacteria exploit. Beneath enamel lies dentin, a living, more porous layer shot through with microscopic tubules leading to the core. These tubules contain fluid and nerve endings. When decay breaches enamel and reaches dentin, the process can accelerate. Sensitivity and pain often begin as temperature and pressure transmit to the nerve inside. The development of caries is not a random event. It is the result of a specific set of circumstances, a perfect storm of factors that must align. There are four main pillars that support the formation of a cavity. First, a susceptible tooth. Second, specific acid-producing bacteria. Third, fermentable carbohydrates, especially sugars. Fourth, time. Acids must stay on the tooth long enough to demineralize. Without all four, caries cannot occur. Poor oral hygiene is a direct contributor. Fail to clean teeth and a sticky, colorless film called plaque accumulates. Plaque is a bustling metropolis of microorganisms. It sticks to tooth surfaces, especially hard-to-reach areas. Inside that biofilm, acid-producing bacteria thrive. Protected from saliva, they bathe enamel with acid every time sugar is eaten. Saliva washes, remineralizes, and buffers. When flow drops, acids linger, risk rises. In its earliest incarnation, dental caries is a creature of stealth. It offers no pain, no sensitivity, no obvious cavity. The very first sign is a subtle change in the appearance of the enamel. A small, chalky white spot may appear on the surface. This white spot lesion signals subsurface demineralization. At this stage, the process is often still reversible. As it progresses, color can shift from white to light or dark brown. A dentist can detect a subtle texture change with an explorer. When decay reaches dentin, sensitivity often begins. Short, sharp twinges with hot, cold, or sweet are common, brief and stimulus-bound. Left to advance, a visible hole may appear. The whisper becomes an alarm. For a dentist, diagnosing caries is like being a detective. It begins with a thorough visual examination under bright, focused light. They search for chalky white spots, dark discolorations, and obvious cavitations. The explorer is used gently to feel surface roughness and remove debris without harming enamel. The mirror reveals hidden surfaces and bounces light into shadows. Some decay hides in tight contact points between teeth. Bite-wing X-rays are indispensable for catching interproximal decay early. Healthy tooth appears light. Decay shows as darker, shadowy areas. New tech, like laser fluorescence, quantifies demineralization for monitoring. By combining exam, gentle tools, and X-rays, clinicians uncover decay's hiding places. The result is a precise plan tailored to the stage of disease. Treatment depends entirely on stage. Early white spot lesions may need no drilling. The goal is to help the body heal itself through remineralization. Dentists may apply concentrated fluoride varnish or gel to rebuild crystals. Fluoride draws calcium and phosphate from saliva to strengthen enamel. Prescribed high fluoride toothpaste or rinse can be part of the plan. Once a cavity forms, damaged tooth must be removed and restored. Tools may include a high-speed drill, air abrasion, or laser. The aim is conservative dentistry. Remove decay, preserve natural tooth. Restorations include durable silver amalgam or tooth-colored composite resins. Composites are layered, light-cured, shaped, and polished to seal the tooth. Near the pulp, medicated liners like calcium hydroxide can soothe and encourage tertiary dentin. To ignore dental caries is to invite serious, painful, and costly problems. Left unimpeded, decay reaches the living pulp. Infection triggers pulpitis, inflammation and pressure build. Pain becomes intense, throbbing, even spontaneous. The pulp dies. Simple fillings can no longer save the tooth. Infection travels down the roots into the jawbone. A dental abscess forms, a painful pocket of pus. Swelling and a general feeling of being unwell can follow. The bone and ligaments can be damaged. Periodontitis may develop. Severe cases lead to extraction, affecting chewing, nutrition, confidence, and smile. Fortunately, this story need not end in pain. Caries is highly preventable. Brush at least twice daily for 2 minutes with fluoride toothpaste. Use a soft brush, gentle pressure, and clean along the gum line. Brushing isn't enough. Clean between teeth daily with floss or interdental brushes. Be mindful with sugars. Reduce snacking frequency and pair sweets with meals. Give saliva time to repair. Choose water over sugary drinks. Sugar-free gum can help. See a dental professional at least yearly, or more often if at high risk. Professionals remove tartar and spot early lesions to halt or reverse them. Preventive treatments like topical fluoride and sealants add protection. For children, protecting baby teeth supports healthy, permanent teeth. Adults should manage dry mouth from medications. Orthodontics can ease cleaning by reducing crowding. In the tapestry of life, creation, and destruction are in constant tension, even in our mouths. Dental caries is an imbalance. Tiny organisms, fueled by modern diets, erode resilient enamel. Understanding the process is the key to control. Knowing causes, recognizing early signs, and appreciating consequences empowers action. From healing early lesions to restoring cavities, even saving infected teeth, modern care is remarkable. We can halt decay and rebuild what was lost. Prevention remains the most powerful tool. Diligent cleaning, thoughtful diet, and regular checkups shift the balance in our favor. The power rests in our hands to safeguard health and keep our smiles bright for years.